Good morning and welcome to another week of United Way for Southeastern Michigan's What's the Word Wednesday, where we share important resources and have vibrant discussions about the topics that matter most to you. My name is Cassie Thierfelder, and today we are joined by our longtime advocacy partner, the Michigan League for Public Policy. With pandemic-era support programs ending, we know that many families in Southeastern Michigan might be feeling overwhelmed with the information on which benefits will be ending and what will still be available. Our goal is to make sure that families don't slip through the cracks and lose benefits that are vital to healthy families and healthy communities. So today, we're talking about the Medicaid unwinding process, or in simpler terms, reviewing the eligibility of every person enrolled in Medicaid in the state to determine if they're still eligible. A few reminders for today's discussion. We will take questions from the audience, so please put your questions in the chat box on Zoom or in the comment section if you're watching on Facebook. Closed captions are enabled in Zoom and Facebook Live. To turn them on, please click on the Show Captions button at the bottom of your screen. I'd like to share a bit more about today's guest. Amber Bellazaire is a senior policy analyst at the Michigan League for Public Policy, where she focuses on state policy and budget decisions that affect Michigan's Medicaid programs. Before joining the League, Amber worked at the National Conference of State Legislatures, where she provided technical assistance to state legislators and legislative staff and monitored state legislation related to injury and violence prevention and maternal and child health. Amber holds a Master of Public Health degree from the University of Michigan. Amber, welcome and thank you so much for being here with us today.
Good morning, and thank you so much for the invitation. I'm happy to be here to talk about a really important topic and one that can sometimes sow a little bit of confusion. So hopefully by the end of this, everyone will leave with a little bit more knowledge under their belt and can have any questions they have answered. So thanks again for the invitation to be here. As was said, my name is Amber Bellazaire, and I work at the Michigan League for Public Policy. For those of you who are not familiar with the League, we are an organization that has been around for more than 100 years, and we really focus on economic well-being and health and well-being for all people in Michigan, particularly those who have been historically left out. And we try to address poverty in a really holistic way. My area of focus is on healthcare, and that looks a lot like Medicaid policy. So happy to be here today to talk a bit more about that. So to get started, we are talking about the federal public health emergency, and particularly a provision that was enacted early in the COVID-19 pandemic, March 2020, that required states to provide continuous coverage to Medicaid beneficiaries if they received an increase in the federal funding for their Medicaid programs. So Medicaid is a state and federal program, and states receive some federal dollars to provide that public health insurance program to residents in their state. And so if states received an increased federal match, then they needed to require protect all of the coverage for those beneficiaries. And so since that means that since March of 2020, if you've been enrolled in Medicaid or CHIP, you have not needed to renew your coverage. You have just had continuous coverage. More recently, the continuous coverage provision has been sort of decoupled from the public health emergency and has ended. So starting April 1st of this month, that continuous coverage requirement has ended. And so what we're talking about today is, what does that mean for folks enrolled in Medicaid or those who support others who are enrolled in Medicaid? And I think to start with, I think it's important to say, well, why is this important? And I would just say that, as was stated at the outset, this is important because we want to protect coverage for the millions of Michiganders who rely on Medicaid and CHIP. Over 3 million people are enrolled in Medicaid or CHIP in our state, and we know that health insurance is really valuable in terms of maintaining folks' health. A lot of folks, rely on regular care to receive preventative services and to help pay for their prescriptions and regular treatments. So we know that continuous health insurance coverage is incredibly valuable. And uh, we want to make sure that this process of resuming renewals is done smoothly. So those that are found to be no longer eligible for Medicaid and CHIP are able to find alternative forms of coverage, whether that be on the individual marketplace, transitioning to Medicare, or enrolling in a private insurance option that they are eligible for. And we know that this is an opportunity for the state to improve enrollment and renewal procedures. And so, if there's ways to make the process of renewals smoother, not just for the next year or so, while everyone is having to be reassessed for eligibility, but moving forward into the future, just to make sure that, again, continuous coverage is something that we see happening more and more in our state, and we see less churn, which is really just that kind of cycling on and off of coverage. So that's sort of the why behind why this is an important topic to be talking about today. But kind of jumping in, so the end of the continuous coverage requirement again just means resuming sort of normal renewal operations, and that means that everyone enrolled in Medicaid and CHIP will, over the next 12 months, need to submit information related to their eligibility. So that means showing their income, their household size, and various other factors, just so that the state can determine whether or not they are still eligible for Medicaid. Um, and I think the biggest piece that I would share with folks is that it's important to make sure that your contact information is up to date with the state. So this really looks like using the My Bridges portal, or contacting a caseworker that you have through MDHHS. So making sure that your contact information is up to date is incredibly valuable, so that you're receiving all of the communication and notifications that you need to be in order to be aware of when your renewal date will begin. And the state has done an excellent job of sort of putting together resources kind of all in one place on a website related to the PHE and this continuous coverage requirement coming to an end, and what beneficiaries and those who support them should know. And I think, again, first and foremost, it's just making sure your contact information is up to date. So whether that be a mailing address, subscribing to text messages so that you're notified when a document has been uploaded to your MyBridges account that you maybe need to complete, things like that. So just making sure that the state has accurate information for you is really, really important, because we do know that lots of folks have likely moved over the course of the 3 years of this pandemic, or have a new phone number or things like that. So just making sure that you are able to be contacted, so you're aware of when your renewal is is coming up. Um, I think the other big piece I wanted to mention is not just for beneficiaries, but for those um, who support those who are enrolled in Medicaid and CHIP. And that would just be to kind of elevate navigator programs that are available in your community. And so a health navigator is someone who helps someone enroll in Medicaid or private coverage. So letting folks know that there are opportunities to receive support. So not just a caseworker at MDHHS, but that there are many entities available to help support if you have questions about your coverage, if you have questions about coverage options that are available to you. And specifically, health navigators would be great for those who are found to no longer be eligible for Medicaid and are really hoping for some assistance as they transition into new coverage. So I think that that's a really big piece. Navigator programs are so beneficial, and really provide that in-person support for those who prefer that, or maybe just don't have time to wait on the phone for a long period of time to get questions answered. And so I think that was just another piece, updating contact information, but then also be aware that there are many resources available across the state to help folks transition to coverage, because ultimately, as I said, the goal is really to protect coverage for folks in our state so that they're not going uninsured, particularly if they are eligible for other forms of coverage. So I will pause there. I feel like I was chatting for a little while, but happy to get into it a little bit more if there are questions coming in. And yeah, thanks again for inviting me.
Absolutely. Thank you so much, Amber, for sharing so much important information with us on this topic. We can definitely see why it's so important for us to get the word out on this process. We do have some questions for you coming in from our viewers today. So first, you did mention being able to update your contact information through My Bridges. And I was wondering, is there a way to sign up for notifications, maybe through email or text, that let you know that you need to do a renewal?
Yes. So My Bridges is kind of like the main hub for adjusting various settings or updating information about your household and your preferences for communication. So I would say, first and foremost, if someone does not have a My Bridges account, to establish one, to set one up, and be sure that maybe you already had one, and try as much as possible, I think, to use the same account and just update it rather than creating an entirely new account. I think there is a hotline available if you're having difficulties to like accessing your My Bridges account. I think there are ways in which that you can get support. But I would say that if you're interested in updating your communications from with the department, that you would log into My Bridges and under settings, and I think it's update my information, renew my information, something like that. But there's a button on the settings that you can select that you would be able to kind of opt into electronic communications, and in that way you would be emailed. Or you can select also text message notifications when renewal documents are uploaded to your My Bridges account. And if those things are not selected, then you would be mailed through snail mail your renewal packet and information in that way. So I would certainly recommend that folks establish their My Bridges account, are aware of how to log in and utilize that, and to update their mailing address, their phone numbers, their email addresses, so that they are able to be contacted in that way. And I would also add that if you have a guardian or an authorized person to kind of handle your affairs, your coverage, that person's information can also be included, so that the department knows to email or mail renewal information to that authorized representative in the case that a person who may be incapacitated or is a child, who is not able to kind of conduct those things on their own, that other authorized representative would be able to be aware of when those forms are available and to submit those renewal forms when the time comes.
Great, thank you. And we have another question. Can you share a little bit more about the eligibility requirements? So how have the eligibility requirements changed? Have they changed significantly? And is there a place to see or reference those requirements and the changes that were made?
That's a great question. So, eligibility requirements for Medicaid programs have not changed from pre-pandemic in terms of income levels and things of that nature. Um, you can also sometimes be eligible for Medicaid programs depending on specific categories. So, for example, if you are a pregnant woman, you might be eligible for Medicaid in part because of your pregnancy status and because of your income. So, most of those things have not changed. What really changed was just renewals were placed on hold for that period of time during the pandemic in order to ensure that their coverage was maintained. So, unless they requested to be removed from the program, they moved out of state or passed away, they were not removed from a Medicaid program. And so just none of the typical eligibility assessments were conducted during that period of time. And that is what is resuming. For folks who are curious about whether or not they are eligible for a program, I would certainly say that going to My Bridges and going through the process of looking through documentations and providing information about their income, their household size, and the various categories that they might fall into would be a place to assess eligibility. Or again, if just kind of in-person support is better, navigator programs or contacting benefit workers through MDHHS who can kind of help answer questions you might have about your eligibility status would be a really great resource.
Thanks, Amber. That actually ties into another question that we received. And I know you mentioned reaching out to health navigators. So if someone is having difficulty with updating their account, what is the best way, or what do you suggest for them to get that one-on-one assistance? Who should they reach out to?
That is a great question. So I'm going to see if I can multitask just for a second. I might not be able to, but there is, I think I referenced that there is a hotline number for if someone is having difficulty with their MyBridges account. I also know that navigators, probably because they support so many folks in getting coverage, are very, very versed in MyBridges, probably much more than I am. And so I would say that if you're familiar with a navigator program in your community, certainly reaching out to ask for assistance in that way. I think they support clients a lot of times in getting kind of one-on-one assistance of sort of, I'm locked out of my account or I'm not able to make an update. So I would say that they'd be a great resource. I also know that there are county offices that are available that you can kind of find your MDHHS county office and their website. And certainly there would be opportunities to connect there if you have specific questions about getting into your account or what's required of you in your county or what resources might be available to help you. But I just keep, beating the drum for navigator programs because I know that they work so hard to assist so many clients and really are aware of all of those like troubleshooting, frequently asked questions kind of thing. So I would say that that's a number one resource I would try to find.
Thank you. So I also wanted to ask, what happens if someone loses coverage? What are their options then? Are there other avenues to get coverage? And if so, how do they determine if they might be eligible for those other options?
That's a great question, and certainly one that we hope we can, address because again, we really want to prevent folks from being uninsured or becoming uninsured. So if someone receives documentation after their renewal process begins and it is determined that they are no longer eligible for Medicaid, they should also receive within that notification information about healthcare.gov or the individual marketplace. And so this would be a place that folks could go and shop around to find the coverage that they are eligible for and be able to determine which makes most sense in terms of affordability for their family. I would say that there are a lot of new resources available through federal action that has really helped lower the cost of a lot of plans that are included on the individual marketplace. And so a vast number, the vast majority of people in the country and certainly in Michigan as well, can find a plan that is, no more than maybe 10. If you lose coverage, you are eligible for what is called a special enrollment period. And so if you lose your Medicaid coverage, you are able to enroll even if it's not in the quote unquote open enrollment time. So I think a lot of folks think of, oh, there's only this short window of time in which I can enroll in a marketplace plan. But losing coverage does allow you a window of time to have this like special enrollment period where you are able to obtain new coverage. And so folks shouldn't worry that they need to wait several months until another open enrollment period opens. Just losing coverage will make you eligible to sign up for alternative forms of coverage. So certainly look on the marketplace, shop around, and reach out to navigators should you need some more assistance.
And I wanted to note for everyone that the helpline for MyBridges that Amber mentioned is in the chat if you need it. We have another question, Amber. Will current Medicaid recipients remain insured until they go through this reapplication process and a determination is made? Can you talk a little bit more about what that process looks like?
Yes, absolutely. And thank you for putting the helpline number. As you can see, I was not able to multitask. So thank you all working behind the scenes to do that. Yes, that's a great question. So coverage will continue until someone is deemed ineligible. So the process that the state currently has is to send what they're calling an awareness letter to let you know your renewal month is coming up. Then you will receive a renewal notice, and that you should receive about 60 days before your renewal period would end. So, for example, this has just started. So, folks would have received an awareness letter at the very end of March, and then they will receive their renewal notice in May, and they would need to complete their renewal packet and submit it hopefully within 30 days, but their coverage would not end any earlier than June 30th. So there is a bit of a window of time in which folks are hopefully made aware, have time to receive their information, have time to submit their renewal information, all before their coverage would be terminated. And then they will receive notification that they have either, they just haven't responded to any of the notifications that have been sent out, or that they have been deemed ineligible. So coverage would continue through all of that period of time. So they would not lose coverage until the very end of June. And that's kind of at the very, very earliest start date. And everyone will receive, it's kind of happening on a rolling basis. So just important to be aware of those awareness letters, to be aware of the renewal packet that you're sent, and certainly to submit it as quickly as possible once you receive it.
What happens if I miss renewing during the unwinding period? If I miss those deadlines, what is the next step?
So, folks who are notified that they have lost coverage because they have not submitted the required forms or have just not responded to any of the notices that have been sent, will be sent information about transitioning to marketplace plans, will be sent information about how to appeal a decision. And I think that piece is really important, because if someone feels that they've been incorrectly deemed ineligible, there's a process for appealing that decision. I would also say that if, for example, someone receives a renewal packet in the middle of the month and they feel like this kind of got lost in the mail or it was delayed, I should have received this, a month or a few weeks earlier. I don't have time to submit it really quickly or before my renewal deadline arises. They have an opportunity to reach out to their MDHHS benefit worker or caseworker and essentially ask for more time. So I think that is important to know, that there are options. It might be difficult to get someone on the phone, not saying that any of this is like seamless or super straightforward, but there is an option that if you feel like I'm not going to meet this deadline in time, that you can reach out to someone to sort of ask for an extension. And I think doing that and being proactive is much better than having to kind of on the back end try to go through the appeal process. So much better to try and not lose coverage and to just ask for an extension if you think you might not meet the deadline. But there are processes in place for folks who feel like this deadline passed and I know I'm still eligible. Can I appeal this decision?
And when it comes to renewal, is there any way for some renewals to be automatic, or will everyone have to go through this process?
That's another great question, and something certainly the league was really vocal about in collaboration with many other partners. There is a process for Medicaid to do automatic renewals. Sometimes they're referred to as ex parte. And we were really big proponents of this, because not only does it make it easier for beneficiaries, those who are receiving coverage through Medicaid or CHIP, but it makes it a lot easier for benefit workers too, because it's a little less paperwork that they're having to handle and communicating back and forth and submitting documents where things could get lost in the mail or things of that nature. So automatic renewals are great. And that usually happens because a beneficiary is enrolled in another public program, something like SNAP or food assistance, things like that. So when the department is aware of information that proves that this person is eligible for Medicaid, they don't need to submit additional documents. And in that case, someone would receive a notice that says healthcare coverage. And they would know you have been passively or automatically renewed, and it would have more information about their coverage and the length of which their coverage will last and when their new renewal date will begin. So that definitely can happen. And we hope it happens for a number of people because, again, it just really kind of lifts some of the burden of having to submit paperwork and prove that you're income eligible and the like. So yes, we hope that happens quite a bit and you will be notified. So if you don't receive anything, that doesn't necessarily mean that you've automatically been renewed. You will receive a document that says like your coverage has been continued. So you would still receive something so that you know that you're someone who is automatically renewed.
All right. And Amber, I have time for one more question. So I just want to ask, what can I do right now to make sure that I do not miss any important information? And what can I do to figure out where I should go to find out what this information is?
I would say that the most important thing is to establish an account on MyBridges and to make sure that your contact information is up to date there. And you can also elect to receive electronic notifications. You can opt into text messages, update your mailing addresses, fill out if you have an authorized representative that you'd also like to receive notifications on your behalf. All of that information is housed within MyBridges. And so I think that's the number one place that I would send people, is just to make sure all of that information is as up to date as possible, because you'll be aware of when your renewal date is coming up, when you might receive an awareness letter, those sorts of things. So you know when to take action. And then I would say the second place would be to, if you have additional questions, go to michigan.gov and search public health emergency, PHE. And there's a website, again, maybe someone can put that link in the chat for us. And it really has so much information. There's a timeline of when all of these renewals will be taking place. Again, a reminder of when you'll receive an awareness letter, when you'll receive a renewal notice, and kind of the difference between those two things. When at earliest you might lose coverage, all of these frequently asked questions. Hopefully we've been able to answer a lot of questions, but if you have additional questions, there's a lot of resources that are kind of housed there. Certainly information about phone numbers to contact if you have questions, talking about the appeal process or where to get more information about healthcare.gov, all of that. So I would say that would be a really great resource for folks who are like, I'm still really confused and I don't want to miss anything. That would be a really great place to go, just to kind of calm those fears and know like there's a lot of information out there and there's a lot of time to make sure that you can continue your coverage.
Thank you so much, Amber, for joining us today. I really appreciate you being here and sharing this information and resources on the Medicaid unwinding process. Before we close, I do have a few more updates for our audience. Are you ready to rise to the challenge? United Way's third annual Equity Challenge begins May 16th and will include 21 new days of engaging content, as well as opportunities to connect with your neighbors about equity issues that matter. The Equity Challenge is free, so sign up today at unitedwaysem.org/Equity Challenge. As a reminder, for anyone in our community who may be experiencing a need, our 211 helpline remains available 24 hours a day, 7 days a week. This includes resources like food, utility assistance, tax assistance, and much more. We always maintain a running list of available services in the community and can connect you to the support that you need. You can also look up resources in your area by using our 211 resource database at unitedwaysem.org/211. April is Global Volunteer Month. If you're looking for opportunities to get involved in the community, United Way's volunteer portal can help. Search for volunteer opportunities that best match your abilities, needs, and interests. You can even set up alerts for the types of volunteer projects or organizations that you care most about. Visit unitedwaysem.org/volunteer to get started today. Next week, we will be joined by our partner, Access, to hear updates on their behavioral health and substance abuse work, including a new state-of-the-art behavioral health center. To stay updated on our upcoming topics and watch replays of previous town halls, please visit unitedwaysem.org/virtual town halls. Thank you, everyone. We will see you soon. Stay safe and continue to live united.